Have you ever noticed your allergies seem to be getting worse every year? Not just with your typical spring allergies, but you're reacting to things like wine, leftovers, or certain foods, stress, and even hormonal shifts during your cycle. A lot of people assume it's just bad allergies, but sometimes what's happening is a little bit more complex, and it involves something called histamine. Today we're going to talk about three things: what normal allergies are, what is histamine intolerance, and what mast cell activation, or MCAS, is. Because if your body feels like it's reacting to everything lately, your immune system may be trying to tell you something. Hi, I'm Athena Newell. I am a family nurse practitioner at Stat Wellness in Charleston. We practice functional and preventative medicine, which means we're always asking deeper questions. Not just what symptom is happening, but why is the body reacting in the first place? So let's start with the basics. So what are allergies? Allergies are an immune system overreaction. Your body encounters something harmless, like pollen, dust, or pet dander, and it treats it like it's a threat. Your immune system releases inflammatory signals, including histamine. That histamine causes things like sneezing, itchy eyes, congestion, inflammation, fatigue, and sometimes even headache or brain fog. This is actually your immune system trying to protect you. The problem happens when the immune response becomes too reactive, and that's where histamine starts to play a bigger role. What does histamine do in the body? Histamine is a signaling molecule involved in several important functions. It helps regulate immune defense, stomach acid production, brain signaling and wakefulness, and blood vessel dilation. Histamine itself is not bad. The issue happens when you produce too much histamine, your immune cells release it too easily, or your body can't break it down efficiently. And that's when people start noticing symptoms beyond typical seasonal allergies. So now let's talk about a thing called histamine intolerance. Histamine intolerance is usually a breakdown issue, not an allergy. Your body relies on enzymes to clear histamine out of your body. The main one is called DAO enzyme, and that's primarily produced in the gut. If DAO enzyme activity is reduced, histamine can accumulate faster than your body is able to clear it. This can happen with gut inflammation or dysbiosis, SIBO, alcohol use, certain medications, chronic stress, and hormonal fluctuations. When histamine builds up, people may notice symptoms like flushing, headaches or migraines, anxiety after eating, heart palpitations, nasal congestion, bloating, or digestive symptoms. Certain foods can make symptoms worse because they naturally contain higher levels of histamine. Examples of these high histamine foods are things like wine, aged cheeses, fermented foods, cured or deli meats, and leftovers. Many people with histamine intolerance notice that symptoms improve when gut health improves. Now, what about mast cell activation syndrome, or MCAS? MCAS is a little bit different. Instead of it being a breakdown issue, the immune system itself is becoming overreactive. The immune cells involved are called mast cells. Mast cells live in the skin, the gut, airway, and blood vessels, and they release histamine and other inflammatory chemicals when the body detects a threat. In MCAS, mast cells release these chemicals too easily and too frequently. Symptoms can involve multiple body systems and may include flushing, hives or swelling, rapid heart rate, blood pressure changes, severe food reactions, digestive symptoms, and brain fog. MCAS is less common than social media likes to suggest, but it can occur and it requires careful evaluation. You can see how histamine and MCAS have some overlap. Why are these conditions often overlooked? Histamine-related conditions can be difficult to recognize. One reason is that symptoms can involve multiple systems. Someone might see an allergist for their sinus symptoms, a GI doctor for digestion, and a neurologist for their headache, and no one is connecting the dots. Another reason is that conventional medicine tends to focus on a disease with a very clear diagnostic test, and histamine intolerance in particular does not have a single definitive test. So many patients end up managing symptoms without addressing the underlying drivers. What are some root causes of histamine imbalance? In functional medicine, we step back and ask why the immune system has become more reactive. Some of the most common drivers include gut dysfunction. About 70% of your immune system lives in your gut. When the gut barrier is inflamed or disrupted, your immune system can become exaggerated. Another common driver is chronic stress. The nervous system communicates directly with mast cells. Chronic stress can increase immune reactivity. Environmental exposures. Things like mold, toxins, or chronic infections can also increase immune reactivity. and hormonal fluctuations. Estrogen increases histamine release, which is why some women notice symptoms worsen around ovulation and around their periods. So what about testing? What are our options? When symptoms are persistent, testing may help clarify what's happening. This may include comprehensive stool testing to evaluate gut health, SIBO testing, nutrient markers such as vitamin D, inflammatory markers, sometimes mast cell mediators such as tryptase or histamine metabolites, but those can be a little bit tricky if you're not in a flare at that moment. Testing isn't always required, but it can help guide more complex. So treatment is usually stepwise. First, we want to stabilize the foundations: sleep, blood sugar, stress regulation, reducing alcohol and ultra-processed food. This will overall decrease your systemic inflammation. But ultimately, we need to address the gut. This may include improving microbial balance or supporting gut barrier integrity or leaky gut. For histamine symptoms specifically, some patients benefit from quercetin, vitamin C, temporary H1 and or H2 antihistamine medications, and DAO enzyme support. In patients with confirmed mast cell activation patterns, additional mast cell stabilizers may be considered, but the goal is always supporting the immune balance and not just suppressing symptoms. So if your allergies feel like they're getting worse every year, it may not just be pollen. It may be your immune system asking for support. And histamine isn't the villain. It's a messenger. And when you understand why the immune system is reacting, we can help the body become more resilient. If you found this video helpful, subscribe and share it with somebody who's living on antihistamines and needs a deeper dive. And if you're in the Charleston area and need deeper help, you can schedule a free 15-minute consult for us to talk through your symptoms and whether a functional medicine approach would be great for you. Thanks for coming.